My name is Shalina. I'm from the University of St. Francis. I'm going to be doing an assessment on you. I already talked to your mom about it. She already said it was okay. I already performed my hand hygiene, so my hands are clean. Okay? Now I'm going to just check your wristband. And I'm just going to make sure that this is you, and it's correct. This is you. Next thing I'm going to check is your temperature under your arm, and the normal temp is 97.7 to 99.0. I am going to check your respirations right above the nipple line, and the normal is 30 to 60. And then I'm going to check your pulse, which is 100 to 160. Next thing I'm going to check is I'm going to check your head. I'm going to take your hat off, okay, baby? I'm going to be checking for any bruising, any scratches that might have happened during delivery, the anterior fontanelle, the posterior fontanelle. I'm going to be checking for the capacita, that one. And that does cross the suture line, and it's firm. And the cephalohematoma does not cross the suture line. And then I'm going to put your hat back on. And I'm going to be checking your ears, making sure they recoil, making sure they're aligned with your eyes. And I'm going to be checking your eyes for any drainage, making sure they're symmetrical. And then I'm going to be checking if the epicanthal fold is present or not, and it is. And then I'm going to be checking the nares on the baby, checking for patency, holding it, making sure the baby's breathing okay. And then I'm going to put my gloves on, get some new gloves. And I'm going to be checking for making sure that the palate is closed. I'm going to be checking for the suck reflex in the baby. And then you can also do that by tapping on the baby's cheek. And then I'm going to assess the baby's neck for any masses, assess for range of motion. I'm going to assess the clavicles for any dislocations or any problems with that, any breakages or anything. Next, I'm just going to check the baby's skin. I'm going to note this color, the turgor, the inner thigh. I'm going to check for jaundice in the eyes, the forehead, the chest, the abdomen, and the inner thigh. The baby doesn't have jaundice. I'm going to check for the baby's creases, making sure there's more than one crease in the baby's hand. And then I'm going to check for the grasping reflex, making sure the baby can grasp hand. Then I'm going to check the umbilical cord, noting any drainage, making sure it's dry. If I need to, I'll clean it with the alcohol pad. It's clean, so I don't need to do that. I'm going to check for respiratory distress, retraction, nasal flaring, apnea, grunting, or seesaw respirations. I am going to check the baby's genitals. This is a boy. So I'm going to palpate the testes, check the urinary meatus. He has rugae on the scrotum. And if it was a female, I would make sure that the labia majora covers the labia minora. Okay, and the baby, note if the baby's circumcised. This baby is not circumcised. I'm going to check the baby's abdomen with my stethoscope for bowel sounds, make sure they're present in all quadrants. The baby's bowel sounds are present. I'm going to do the Babinski reflex by touching the baby's foot, making sure that the toes, they respond. I'm going to do the Moll reflex by making sure that the baby awakens when I do that. I'm going to make sure that the baby's arms recoil when I do this, and they do. I'm going to, Palmer, that's a Palmer. I check the baby's spine, and I'm going to be checking for hair tufts on the sacrum or any bruising. I'm going to note the contour of the spine, and this baby's fine. And I'm going to ask the mom when's the baby had the bowel movement last, making sure the baby's urinating, making sure the baby's eating every 2 to 3 hours. The baby should have urinated and had a bowel movement within the first 24 hours.